Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hi, I'm Dr. Lisa Hernandez, and I'd like to welcome you to Your Health radio and television program on AM 1240 KNRY, AMP Channel 24, and on the web at ampmedia.org. I will be your host today, and my guests will be sharing helpful information to help you improve your health. Remember, we have added a new feature to the program where we will take select questions from the audience on the topic of the day. You can submit your questions via the email at mchd2010@gmail.com. Again, that email address to submit questions is mchd2010@gmail.com. Our next program's topic will be on immunizations for adults and children, so please submit your questions. Are you prepared for a disaster? Do you know what to do if there's a fire or flood or an earthquake? Are you ready to protect yourself, your loved ones, and even your pets during an emergency? If not, listen in. We're going to talk to experts today that will help you know what the Monterey County Health Department and community is doing to prepare for disasters. They will also teach you tips on how to prepare yourself and your pets for the unexpected. My first guest is Dr. Krista Hanni. She is Manager for Surveillance and Preparedness at Monterey County Health Department. Dr. Hanni, thank you for coming on this lovely afternoon.
I'm very pleased to be here to talk about preparedness.
Well, welcome. So let's get into the questions. We've seen on the news various types of disasters, from the earthquake in Haiti to the oil spill in the Gulf of Mexico. And I was wondering, how do we prepare here in Monterey County? Would our response be pretty much the same?
Well, there's definitely a structure to the response, irrespective of the type of disaster. What we all train to at various levels of government and for other agencies that might be involved in a disaster response is the incident command system. So this system was developed actually after the fires in California back in the 80s, when there was not a coordinated system. Everyone had different terminology that they were using, different people in charge, so it ended up being pretty mixed up for everybody involved. And so they decided they needed to go back to the drawing board and come up with a system that would be effective for everybody to use. Gives them the common terminology. So in this incident command system, there is the incident commander, and then there's sections. And depending upon the level of the disaster, how large it is geographically, or the severity of it, the intensity, there may be some of these sections would be activated. The incident commander always has a few people answering to him, such or her, such as the public information officer. Then there's other sections that tend to be very key, and you actually are hearing about them during the Gulf oil spill, and when you're hearing people being interviewed or they're talking about, so there'd be planning. Planning's responsible for making sure all that data is gathered, is coming in. There's a real coordinated aspect to that, and that information's coming in to make the plans as you go into the coming week or the coming months. And during meetings, they talk about those plans and set those down. Then there's also logistics. That has a lot to do to make sure that all the equipment is where you need it, when you need it. Then operations, which is the real nuts and bolts, the people that are actually out doing, in the case of the response. If it was an outbreak, the ones who are managing or controlling for the disease, preventing the spread of it. And then lastly, but not least, because it's always important, there's finance. Just ensuring that there is the funding for it, that everyone's keeping track of all the costs, because it may go back to the originator of the disaster, if there is one, if it's man-caused or human-caused. And if not, then there may be also the federal funds that may pay for more than natural disaster, like say a hurricane response or an earthquake response.
So this system works throughout the nation, not just in California, but
right. So
everywhere.
we all train to this. Everybody who might respond to a disaster takes different levels of training and different amounts. You can go to the FEMA website and look at those trainings and take them and become certified in that. Right now, for example, in the Gulf, people who are responding are probably being given on-the-spot training or emergency training to then be permitted to respond and be part of the disaster response.
Okay. And for Monterey County, what kind of emergencies are we trained to handle?
Well, in Monterey County, what we have are a lot of plans, and we've developed plans based on the types of emergencies that may occur. Now, some of those we have to prepare as part of our preparedness funding and the scope of work for that, and that's just because the nation as a whole wants, at the county or the city level, people to be prepared for the government agencies to respond if it was radiological, nuclear. Now those sound really big, but there are ways and means of responding to that. And then there are other types of responses that occur or may occur that you want to plan for and you hope they never occur, such as a mass fatality incident. And we do have a disaster plan for the health department, and there's a variety of annexes to that for how the health department would respond. And then of course all the cities have their disaster plans, and then there are other agencies that may have their disaster plans. So earthquake, tsunami, all the natural ones, and then human-caused ones. And then of course there may be the really intentional human-caused ones, like a bioterrorist event. And we do have components of our plans that are part of that response. If it was such a case as a bioterrorist response, then of course the federal agencies would be involved immediately.
And do we practice these plans, or how do we know that they're actually going to work if we ever come across a disaster or an incident where there's a mass fatality with several people injured or killed?
You know, it's a great question, because you don't want to have a plan that just sits on the shelf and no one knows about it even when the disaster occurs. No one knows that all this planning had occurred. So they really need to be live documents. And what you do is, of course, there's trainings. You look at what trainings are necessary. They've maybe been identified with your plan, whether it's for, you have influenza season coming up and you want to make sure that all of your healthcare providers have all the current information on how to manage influenza and deal with outbreaks at their facilities, et cetera. You might give them the education about that. But then even more importantly, and what we've really started to do more and more, we have several every year now, are the drills and the exercises where we actually get that plan out, dust it off, think about who needs to be invited to the drill or exercise. Definitely let everyone know it's just a drill or an exercise, it's not a real event, but then let them know maybe we're going to be testing certain components of the plan, whether it's communication, whether it's actually on-site activating equipment, breaking it out, transporting it. For example, with our Strategic National Stockpile Plan, we definitely recently had some pharmaceuticals that were here during the influenza pandemic, H1N1 pandemic. We wanted to move some of those around the county, so we used that opportunity to test the plan for moving Strategic National Stockpile around the county.
So that's your chance to kind of figure out whether there are any glitches. Have you figured out all the contingency plans if anything doesn't seem to work out right?
Right. I like to tell people that it's a bit like when you're planning for a wedding. So depending upon the size of the wedding, you may have a written down plan. You may even have to, besides yourself being the incident commander, you might get a wedding planner, and they're the incident commander, because someone has to be assigned to that. Depending upon the size of the event, you may ramp it up as to who that person would be. And then, of course, with all the planning, you've got your logistics and your operations and the finance aspect of it. And then the night before, or a few days before a wedding, you might have a rehearsal dinner where everyone basically goes through the plan, sees how it works, has the key members there. They might talk about it afterwards, they might tweak it a little bit, look at if there's any gaps in their planning. I know that we don't think of it in such a regard when we're doing a wedding, but really there's some basic premises that we use in a day-to-day basis with some of the events in our lives. And for a response, you have to think about how that would just be ramped up and handled at a more government level.
So can the general public see these plans? Are they available for our information?
Yes, we definitely post the plans, usually on the website, and try to keep them updated out there. And then, of course, we have copies that are distributed to all the various agencies that are involved in the various planning processes.
Great. And can you give us an example of what the health department does in an example? I mean, in a disaster?
Sure. Well, I think recently, I mean, everybody probably was more aware of the health department and their response during a disease outbreak, and that was the H1N1. If it's not a disease outbreak, but of course the health department is always responsible for protecting the health of the public and controlling disease. So irrespective of whatever kind of disaster it might be, usually there may be a component in there where the health department is involved. But when it is really the disease itself is the event, in the case of H1N1, then we were more of the incident commander, and we certainly activated our own Department Operations Center and kept our Office of Emergency Services as well as county administration informed of everything of how we were doing it and what we were doing. So we had our incident commander was a health officer, and we had our pan-flu plan, a pandemic flu plan, because H1N1 this past year really was when we were waiting for pandemic flu, ended up being it was H1N1. It wasn't really exactly the way we were picturing it to be. They thought it was going to be a more severe type of a strain of flu, and luckily it wasn't, but we still were able to test and use our pandemic flu plan and saw that we would maybe need to have a couple different levels for it depending upon the type of illness, and that had been in the state plan, and we were able to use components of that. So we got that out. We initially, in the beginning stages, just like everybody else, we were trying to get the information in to determine what our plan, our approach would be. And so there was a lot of data accumulation in the first few days to few weeks. We definitely ended up having some meetings or gatherings of key personnel across the county that might be involved. And we call that our Enhanced Surveillance Committee. And we brought them together, had discussions about what they were seeing, what their response plans were going to be, let them know about ours, kept everyone informed. And then eventually we began to have our weekly meetings where we were looking at what was needed in the county, planning for it, thinking about the vaccines as they became available, how we were going to distribute those or help coordinate the distribution of those in the county. And that included then determining if we were going to have clinics, immunization clinics, or working with another healthcare type provider in the county, such as Visiting Nurses Association, to help with the distribution and the vaccination campaign. So there was a variety of levels that were kept coordinated by all of the different groups that might be involved, meeting, keeping them informed, having our weekly meetings in the health department, and then deciding when we needed to ramp up or ramp down. A key component really throughout all of this was communication and communicating the message. So we also, as part of our planning, decided, because with H1N1 as it developed, it really looked like personal protection was going to be really important. We didn't know when the vaccine was going to be exactly available. There were some estimates on that, and it kept getting pushed out. So we really began focusing in our county on a messaging campaign, getting out that you needed to wash your hands, cover your cough, but in the right way, covering your cough, and then staying home if you were sick. And we thought we wanted to make sure the kids were involved in this in the county, because they're really good at taking messages home to their parents as well. So one thing that our public information officer ended up doing was doing a contest for a poster that we ended up picking some winners and putting them into several posters that were distributed around the county. I think I gave one for you there to look at, as well as a calendar. And the calendar just looked at several of those posters, one per month, and it really profiles all of the wonderful art that was turned in, but the messaging that they were able to convey, the students were the ones that really made the messaging most effective. And of course, this is being distributed now, the calendar, because it's part of our school season. So the calendar covers the school year. And then there also were educational materials that were handed out often when there was the vaccination clinics or at other county events. There was hand washing campaigns. Our regional teams that had nurses and community service workers on them would go out and teach people about how to wash their hands and protect themselves. And there's definitely great incentive items here. We call them educational materials. So this is just your hand gel.
Is that a hand?
It is a hand. All right, so it sort of gets the point home. The other thing that we did that was very important, I think, was make sure that we were able to get the data out in as timely a manner as possible, so that there was a real awareness in the community about what we were doing and what they needed to do. And the data helped back that out, so they knew that all the decisions we were making were really being made with the best data available.
Wow. Well, we didn't know what was going on behind the scenes, did we? We just saw these great posters and stuff, and I think that's really important. You mentioned communication, which is important both for the partners of the health department as well as to the community. So thank you very much, Dr. Hanni. Just one question I did have from the general public. We have a few seconds to answer. Where else can the general public find out information during an emergency?
Well, you can be prepared beforehand. And certainly that you're going to learn more about that with other speakers that are coming on, and they can become trained even if they're in the healthcare industry to become disaster healthcare volunteers. But during an event, when it's going on, it's really important. You can look at our website. We'll update it with the most recent information. There might be public service announcements, information. We try to get it out on the local news stations. For more general information, we're starting to work more closely with our 211 center in town, and people can call and be given the more general information. If it's a more acute emergency or information needs to get out into a particular community really quickly, there's a program called Alert Monterey that we use, which calls phone numbers within particular geographic areas and plays a recorded message on their phones to tell them, for example, during fires, maybe if the fires are coming over the hill towards a community, to alert people to vacate their community and the route to do so, and then where the emergency response centers that they could go to would be.
Well, thank you so much, Dr. Hanni. It was a pleasure speaking with you, and I've learned a lot about what the health department and the county is doing for preparedness. And thank you for taking so much time from your schedule.
You're very welcome.
We're going to take a short break, and we will be back in about 2 minutes. This is Your Health radio and television program. Thank you.